Well, you know what it is. It's Wednesday morning. And if it's Wednesday morning, it's time for another episode of the About Mansfield Consumer Advice Series. Appreciate you being here today. And if it's Wednesday, which we do every Wednesday, when I'm not on vacation or sick or she's out of town. Try to do these every Wednesday. We do these topics of health and wellness. And specifically, let's just go and bring her in, is Dr. Jordan Adams. She's a chiropractor with Calibration Chiropractic and Functional Health based right here in Mansfield, Texas. First of all, Dr. Jordan, say hello to our audience.
Hello, everyone. Good morning.
And today we are talking about why parents often take their newborns to a chiropractor. Now, before we get into this, I am a patient of your husband, Dr. Joe. I've been at your office, and I've seen newborns in your office. And I've seen where I was lying on the table being worked on by Dr. Joe, and you were right there at the next table working on a newborn. And so let's start off with, why do parents often take newborns to a chiropractor?
There are many different reasons a parent may consider taking their newborn to a chiropractor. Everything from they want their kid to start off with a well-adjusted life, so that would be more of a wellness reason, to some more musculoskeletal conditions that we often see with babies. And these can include torticollis. We can dive into the details of these here in a minute, but it's torticollis. Plagiocephaly is a big one, even colic, constipation. There are a lot of things that babies can deal with or suffer with that chiropractic can help.
Let's go ahead and take these one at a time. Now, you mentioned a word that up until about 20 minutes ago I had never heard of, called torticollis. You mentioned it. It was the first on your list. Explain what that is and how a chiropractor can help that condition within a newborn.
Yeah, so torticollis, also known as wry neck. Now, this isn't a condition that only impacts babies. Adults can deal with this as well. But basically, what it is there's a muscle that connects your sternum or your collarbone all the way up to the base of your head. And it's called the SCM muscle, or the sternocleidomastoid muscle. And what we see is with cases of torticollis, you can have a contraction or a spasm in this muscle that ends up with a head tilt with a little bit of head rotation, and it limits range of motion. But this is really important for infants, because if your infant has torticollis, not only are they going to have that decreased range of motion, but this can lead to that condition called plagiocephaly, which is flat head syndrome, where you have a flattened part of your cranial bone or your skull. So we can help with that as well. And it can also impact a mother's relationship for nursing. And so if you're noticing that your baby has a preference on one side versus the other when they're nursing or latching, this can often indicate torticollis as well.
And then what are some of the steps that you take to alleviate torticollis?
So we adjust as chiropractors. We adjust. Now, with babies, you've been in the office and you've seen this, it's very different than adjusting an adult spine. It's a very soft pressure, sustained pressure. With cases of torticollis, we're looking specifically at areas of the neck to figure out where some of these adjustments need to occur. And we can also layer on gentle stretching to help loosen up the mobility of that SCM muscle.
Right. That's one thing that I did notice when I mentioned that I was in the office and you were working on a newborn. It seemed like there was a lot of just real gentle stretching going on. And so the second condition that you mentioned right there is plagiocephaly.
You got it.
Yes, excellent. And which you mentioned was a flat spot on the head. And number one, how do they get that condition, and what are the steps that you take to alleviate that?
Yeah. So torticollis is one way that they can end up with plagiocephaly. Another way is just laying baby down on his or her back all the time. And that can also create that flat spot. Sometimes too, this can be a cranial misalignment that shows up through the birthing process. Now, what's really cool with chiropractic is, and this is an area I get really excited about, is craniosacral therapy, specifically looking at the movement of the cranial bones. And when we can figure out where the cranial bones are restricted. Now, a lot of people are surprised to hear that your cranial bones can actually move. And
Yeah.
with a baby, they're designed to move so that baby can get out of the birth canal. So they actually, in the birth process, they're designed to overlap. So right at the top of the head, the two plates that come together right here will actually overlap through the birthing process.
Huh.
And then what we should see is they should settle back to their normal alignment. Sometimes it just needs a little extra help to do so. So plagiocephaly is looking at how some of these cranial plates may be restricted and how we can help to move them back to a normal natural alignment.
And the way the cranial moves in the birth, if it doesn't come back to realignment, I've seen, is this where I've seen sometimes newborns are wearing helmets or some type of headgear to help the cranial bones go back to. Is that? Am I right? Am I on the right track?
Yes. Yes. So there are often two routes to help correct the cranial alignment. One of them is that craniosacral or chiropractic approach. The other is a helmet approach. I always tell parents just, you can try the conservative, the chiropractic first, or if it feels right for you, do the helmet. Being a chiropractor, I've seen great results with chiropractic, but we've seen patients who have also used both. So you're right.
One of the conditions that a child go through, a newborn goes through, that I always hear from especially newborn parents is colic. Oh, my baby sleeps during the day and is just wild and cranky and during the nighttime, and it doesn't sleep. Can a chiropractor help colic?
So colic, I think, is still a little mystery syndrome. It's kind of a label that gets thrown on these fussy kids, and there can be a variety of contributing components to colic. Everything from a dietary intolerance, a lot of times that could be a cow milk protein allergy. We see that a lot. So that can disrupt the GI system. That can create a lot of gas, which can make baby fussy.
Uh-huh.
Some other elements may be a poor microbiome. So we can talk to parents about probiotic use if it's indicated. But the area I see a lot is just a dysregulated nervous system where the baby has a hard time integrating all of the sensory input coming towards it. And if we can get the nervous system balanced through regular, consistent chiropractic care, baby starts to have an easier time adjusting and adapting to the outside world, and that can eventually help to decrease the colic symptoms.
And constipation, because that also then lies into the nutrition, and so chiropractic care can also handle constipation in newborns.
Yeah, well, if you think about it, if your sacrum or your pelvis is out of alignment, or if there's any rotation or twisting through the pelvis, that can put stresses and strains on the intestines that can make it harder for baby to have a bowel movement. And so what we want is to have not only the spine balanced, but the bones of the pelvis, the soft tissues of the pelvis balanced and at ease so that baby can eat, digest, and
do its thing.
do its thing.
In the 60 seconds or so that we have left in this 10-minute nugget of information, and again, folks, we do this every Wednesday, 10 minutes of information every Wednesday. In the minute or so that we have left, is there anything else that you would like to add regarding newborns and chiropractic care?
Like I said at the beginning, you don't have to wait for your baby to have an issue or a problem to see a chiropractor. Both of my kids were adjusted at birth. My oldest one was adjusted actually a day after birth, and my second one was adjusted within an hour of birth. So I've had the honor and the privilege of helping to start babies off on the right foot, and that's always a great time to start getting adjusted. The second best time is now. So however old you are.
Now. All right.
Now.
Actually, it took, personally, it took me decades. I think I was in my 30s when I had my first chiropractic adjustment. As a result of that, and as a result of loving going in and being adjusted, I transferred that to my son, who started his chiropractic care at about 15, 16. He loved it so much. When he starts having kids, he's not a dad yet, but when he starts having kids, I'm going to recommend that the newborn start with chiropractic care. If someone, Dr. Jordan, if someone wanted to reach out to you in regard to newborn chiropractic care, or even the pregnancy process, which we've been talking about for the past several weeks, how can they reach out to Dr. Jordan Adams?
As always, Steve, the best way is on our website to get all of our contact information, and that is calibrationmansfield.com.
Calibrationmansfield.com. Dr. Jordan Adams, we do this, as I mentioned, every Wednesday morning. Let's do it again next week.
All right, we'll see you then. Bye.